Hello everyone, welcome to another presentation of the kind of work that my team and I here at London Dental Specialists carry out on a routine basis. If you like these videos, please don't forget to subscribe to our YouTube channel and also follow us on Instagram and Facebook at London Dental Specialists. So let's get into today's presentation. You will recall from yesterday that I said that I was presenting half of a case where the patient was referred to see me because she had a cyst in the lower left and generalized gum and implant disease. So we talked about what we did in that case, and today is going to be what we did for the rest of the mouth. So let's just quickly summarize what was going on in this lovely patient's mouth. Again, yellow line here represents the amount of bone loss that has occurred in this lovely patient's mouth, and the green line represents the original position of the bone when the teeth first came out. When the green and the yellow line are relatively coincident, it means that there hasn't been any kind of bone loss, and when they begin to separate at the back, you can see that there has been some bone loss. And same again in the upper jaw. Yellow line represents bone loss. Green line represents the original level of the bone when those teeth or implants were first placed. And again, they're divergent at the back of the mouth, back right, back left on the upper jaw, and they are pretty much on each other in the upper front, which is exactly what I identified when I examined the lovely lady. So the diagnoses are the same for this particular patient, because it's the same patient from yesterday. So let's look at exactly what we did for all the teeth in the upper and the lower left. This particular tooth, this is the upper left first premolar, had a really deep pocket and also had a crack in it. So unfortunately, we had to replace that tooth with a same-day implant. So what we did was take the tooth out, place the dental implant, and place a temporary tooth on the day to avoid a gap in her smile. I wouldn't want a gap in my smile, and I therefore wouldn't want to do that to anybody else. This last tooth in the upper left, unfortunately had too much bone loss associated with it, and there was no advantage. To trying to do anything fancy to save it, so the patient agreed to have the tooth extracted as well. And then on the right side, the green lines represent the original. These green lines represent the original position of the gum, and you can see that as a result of the gum surgery that I did, there has been some gum recession. But the patient is absolutely ecstatic, and we'll come on to that in a second. The only way of getting her pockets, which were on average approximately 8 to 9 millimeters, the only way of getting them down to safe, manageable levels, and they ended up being approximately 3 to 4 millimeters, the only real way of getting them done properly is with our surgical options. So what were the actual results for the whole mouth? Well, yes, all gum pockets were 4 millimeters or less, and the scientific evidence is very, very clear. If you get the pockets down to that level, the chances of you keeping your teeth for the rest of your life are actually very, very good with maintenance. The sensation to her lower lip was fine, preserved, no problems whatsoever, and as you can imagine, she was extremely concerned about this and extremely happy that the lip was normal. And to be honest, in the grand scheme of things, let's be honest, it's not the end of the world, but it would affect speech. It would affect our ability to interact with people, kiss our partners. It's quite profound if the lip ended up being numb, and that's why I think it is pretty important just to try and avoid the problem if possible. Again, gum recession, very normal. I've said this before. It's a normal consequence of successful gum treatment. This patient was particularly ecstatic because when it came to paying attention to her mouth, my goodness, she was meticulous, absolutely meticulous about the way she cleaned her teeth, and therefore knew how deep her pockets had been for the last decade. So hearing such low numbers of pocket depth measurement at the end of surgery really pleased her no end. In general, it took 3 months to complete everything start to finish. That was just because it takes 3 months for the implants to heal. And once the implant has healed, I can swap the acrylic or plastic temporary tooth with a porcelain one. All of the surgery on the right side and the left side was all carried out in 1 day under intravenous sedation. That's what most patients want. They just want one healing period and then they can forget about it. Quite frankly, that is how I like to do surgery as well. In general, it cost the patient £12,000. I'm sure you can imagine that her ability to eat and eat with confidence ad infinitum is priceless, generates a massive value in terms of the patient's life for that investment. So why not either speak to your dentist and ask your dentist to refer you to me just to investigate your gum issues, or you could just pick up the phone and contact us directly. We will be only too happy to work with you to treat whatever dental concerns or conditions that you have. And I look forward to hearing from you soon. Many thanks.